cervical cancer, if we talk of the history of cervical cancer, in India especially, cervical cancer at one point of time, it was the number one cancer which happened, and it usually happens in the uh, middle class, lower socioeconomic status people where there were hygiene issues. What do I mean by hygiene issues? That people are not maintaining good sexual health and good personal hygiene. So that was one of the major reasons. And if you look at the upper middle class or the higher socioeconomic society of our country, the incidence of cervical cancers was very low in these group of patients. But as the time has gone by and we have done more and more research and more and more infections have come in, so cervical cancer is also found in few groups of higher socioeconomic status people as well. Now, first, before we go ahead, let us talk about what is cervical cancer. Now, we all know about uterus, where the children are, they grow and the birth take place. So, the opening of the uterus, that is the mouth of the uterus, is called as the cervix. And any cancer which is developing at the mouth of the uterus is called as a cervical cancer. Now, what is cancer in the cervix? How does it behave? We all know there are normal mucosa. Our the inside of the mouth or the mucosa at the cervix, it looks pretty red and healthy and very vascular. But whenever the cells within the mucosa they start growing or they start behaving abnormally, what do I mean by abnormal cells is like the normal squamous epithelium turns into a dysplastic. Dysplastic matlab anything different from the normal appearance of these cells. So, and then this dysplasia gradually uh, converts into cancer. That is, it starts multiplying in a very abnormal manner and it takes the form of cancer. So that is what a cervical cancer is. And these cancer, they do not, have a stop signal and they keep on multiplying and they continue to grow. And what do they do when they grow? One thing is they destroy the cervix completely. They obstruct the mouth of the uterus, which causes a lot of infective components inside the uterus. It also grows outside the uterus, goes to the pelvis, involves your urinary bladder, your rectum, and through the blood or the lymphatics, it goes to other organs where it causes damage to lungs, liver, brain, bones, all these things. So that is a kind of damage a cancer can do. So this is in brief what a cervical cancer is. Now let us go further ahead and see what all changes we find when a cancer develops. Now, 80% of cervical cancers develop because of a viral infection that is known as a HPV, that is human papilloma virus. Now, this human papilloma virus has various forms, and the form 18 and 16, that is the strain 16 and 18, they are the commonest causes for cervical cancer. And whenever a woman who's having unprotected sexual activity and that too, unguarded, or you have multiple sexual partners, so this virus gets transmitted through sexual contact. And when this virus lodges on your cervix, it causes gradual changes within your cervical mucosa and which eventually develops into dysplasia and cancer. So that is one of the mechanisms of developing cancer in cervix. The other mechanisms are that there could be some changes in your DNA. We all understand what genes are. So any changes happening within your genetic mutation or the genetic makeup of the cervical mucosa, which induces abnormal proliferation of cervical squamous cells. So that also leads to cervical cancer, and this contributes to roughly 20% of cases of cervical cancer that we see. At times, what we have also noticed that even the human papilloma virus also induces certain genetic changes that happens within the cervical mucosa and leading to a cervical cancer. So that is the reason, getting a mutational profile or a genomic profile of this cancer is very important, and doing an HPV testing so that we can, help prevent this cancer in future. So in my subsequent slides, I will also be talking about the vaccination and the preventive programs. But before that, let us talk about uh, some preventive measures and how do we treat cervical cancer. Now, we all know that cancer is something where we do not have symptoms when the cancer is very small, or that is in stage one. We all know stage one cancers are very small, and at times they do not have any symptoms. So, how do we detect cervical cancer? Now, cervix is one of the things where everything is visible. All you have to do is just put a colposcope and have a look. And the looks of these cancers are very characteristic and classical. So even by just looking at the cervix, we can tell you whether there is a possibility of cancer or no. So we look for growth in colposcopy. And then what happens when there is a mass or something? We put a colposcope and then we do a biopsy. Now, let us talk about the symptoms. How would a woman present if she develops a cervical cancer? In early stage, as I said, patients may rarely have any symptoms except a minimal spotting after the intercourse or a post-coital bleeding, what we call as. So that is one thing that may happen, that immediately after you're having a intercourse, you get a bleeding spot or something. That is one of the very early signs of cervical cancer. You may have, in between your periods, you may have bleeding, which may be very erratic, that can happen anytime. So bleeding per vagina is one of the commonest symptom that patient may have, and especially immediately post after an intercourse. Next, the if once the cervical cancer grows and it involves your pelvic walls, so the other feature you may feel as a heaviness within your pelvis, and you may have pain. So these are one of the signs when your cervical cancer becomes slightly advanced. When it stays for a longer time, it becomes infective because there is a raw area that develops around the cancer. So that gets infected, and that is the time you may have fungal infection, you may have bacterial infections there. So apart from pain, apart from bleeding, you may have yellowish discharge or you may have a whitish discharge coming out of your vagina. So which is again a sign of a fairly advanced cervical cancer. The other signs as the cancer grows further, it involves your urinary bladder, or that is your bladder which is anterior or above the cervix, and your rectum behind the cervix. So if it involves the urinary bladder, you may have bleeding in urine. You may have difficulty in passing urine. So you may have a urinary obstruction. You may have pain while passing urine. So all these are some symptoms of an advanced cervical cancer, which involves the urinary bladder. Then you may, once the cervical cancer involves the rectum, that is your passage where you pass your stools, you may experience bleeding in stools. You may experience severe constipation. You may experience pain while passing stools, and all those kind of features. And fever, of course, when you get infection. So that is how the cervical cancer, that is the story of a cervical cancer, how it grows. but we do not have to wait till the time you have all these symptoms. We have to catch the cervical cancer when it doesn't even cause postcoital bleeding. So, what is the method for doing that? So, let us talk of, before I go on to the treatment, let us go on to how do we screen cervical cancers. Now, screening of cervical cancers is very simple and it is a very low cost affair. It doesn't cost you much. We just need two things to be done. One is a colposcopy. Colposcopy is nothing but just a clinical examination by a oncologist or a gynae oncologist, wherein we put a colposcope and look at the cervix. We see the cervix with our naked eyes and see the shape, size, or any kind of a distortion that happens in the cervical mouth. The other thing we do is a pap smear. Pap smear is a very simple test where we take some scrapings out of the cervix and we examine it under the microscope. And what we do in the microscope is we look at any kind of an abnormal mucosa or any kind of an abnormal cell that we have taken out from the cervix, and we characterize into some 4 or 5 categories. Depending on that, we tell you to go ahead and do a biopsy. So that is a very simple way of screening cervical cancer. Next, coming on to the treatment. Now, let me tell you, cancer comes under the curative perspective of all diseases. If you have hypertension, you have diabetes, maybe you are not able to cure hypertension or diabetes, but you can control it. But cancer is one disease which, if you act on time, you can cure cervical cancer. For cure, now it all depends. We all have heard about the stages of cancer. Now, cervical cancer, there is a stage in cervical cancer, what we call as in situ cancer cervix. In situ cancer cervix means that the cancer has developed, but it has not infiltrated into the cervix or the cervical muscles. So it is still limited to the mucosa. So these kind of cancers can be treated completely without sacrificing any function of your organ. If a lady wants to bear children with this cancer, if we catch a cancer in the in situ stage or what we call as a T0 on the stage 0, then what we do is we do a cone biopsy, or what we do is a conization of the cervix, where we just take a small cone and we remove that tumorous part, and which leads to a complete cure of this cervical cancer. And you do not need any radiotherapy or chemotherapy or surgery for big surgeries for these kind of lesions. So that is the importance of screening or detecting a cancer at a very early stage. Unfortunately, if you have missed the carcinoma in situ stage and you have gone on to stage 1, even then, when there is a frank malignancy which is small, which is involving just maybe one of the quadrants of your cervix or the uterus, we can still look at cure. We can do a slightly bigger biopsy. We can ampute the cervix, and we can even do a partial removal of that part of the cervical mouth, which eventually leads to cure. And these kind of tumors also may not require radiotherapy or uh, chemotherapy or removal of full whole of uterus. Once we miss this stage also and we go on to a stage 2, wherein your so the cancer has involved practically whole of the cervix, and it is impossible to remove the whole of cervical mouth. So what we do, we go ahead and remove the uterus, we remove the cervix, we remove part of the vagina, and we also remove some lymph nodes wherein the cervical cancer drains. And looking at the histopathology, there is a high possibility that you may or may not require radiotherapy, uh, to consolidate the treatment. Next, if you go on to stage three is an unresectable stage where you cannot do a surgery, but some patients in this group also can be cured by the use of only radiotherapy and chemotherapy. So radiotherapy here continues for almost 5 to 6 weeks, which is given from outside, and some part is given from inside as well. And then you get weekly chemotherapy along with it. So almost, I would say 65 to 70% patients, even in stage three, wherein surgery is not possible, can be cured with radiotherapy and chemotherapy alone. Then comes a stage where the tumor has gone beyond the pelvis and it has become stage 4. So what do we do in such cases? In these cases, there is a heavy bleeding in the patient that happens. So at times what we do, we use radiotherapy to stop the bleeding, and depending on the fitness of the patient, we start chemotherapy, targeted therapy, immunotherapy, or whatever we do. In these kind of patients, we do a biopsy. We send the biopsy for a complete genomic profiling, that what kind of a genetic mutation has happened, which has given rise to this cancer. And if we find any kind of a mutation which we can target, and wherein we can give some medicines which can control the cervical cancer for a long time, we do it. But unfortunately, majority of the patients with stage 4 cervical cancer do not survive beyond 2 to 3 years. That is in the best scenario. So that is the advantage of detecting a cancer in stage 1, 2, and 3. Now, as we go up from stage 0 to stage 4, the chances of survival, they keep on reducing. Stage 1, stage 2 patients, they have one of the best survivals and with minimal toxicity. And stage 3 may have a good survival, but with some compromise because they do have some side effects pertaining to chemotherapy and radiotherapy. Stage 4 people, their survival is limited because this disease is incurable, and they may have a lot of side effects pertaining to the treatment. But in stage 4, we can only prolong the life of a patient, but we cannot cure it. So now we understand what is the importance, of detecting this cancer early, and which is just spending 15 to 20 minutes with your oncologist just once in a year. That is more than enough. And I feel for an extension of 30 years of life, 15 minutes with a doctor is not a big deal, or a big cost to all of you. We all own cars, right? Now, before the servicing of the car is due, we already book it and get the car serviced so that the car doesn't give us trouble when we are traveling from point A to point B. So similarly is our human body. We never get our body serviced. That is, we don't get ourselves checked. What is the guarantee that whatever body you have at the age of 20, you will have the same kind of a physique at the age of 40? And in 20 years, your body has not deteriorated at all, or you have not contracted any kind of a disease. So that is why we always recommend a yearly screening for cervical cancer, so that we can detect it early, we can cure it with minimal side effects, and you can have a very long workspace, or your work life doesn't get compromised. You can live with your family for a long time. So this was something about the treatment of the cervical cancer. Now let us discuss, do we have something which we can prevent cervical cancer from happening? How can we do it? Yes, we do have. Past 10 to 15 years, we've been using cervical cancer vaccines. You all must have heard about cervical cancer vaccines. Now, what is a vaccine? First of all, vaccine is a drug, which we all know about vaccines because we used plenty of them during the COVID times. So vaccine is something that prevents the occurrence of a disease by virtue of developing some kind of an antibody or antigen against that product, and we don't get that disease. Like we had COVID vaccine, wherein you developed antibodies against the COVID virus. And whenever the virus gets into your system, these antibodies go ahead and kill the virus. So same thing is there for cervical cancer. We know that 80% of the cervical cancers, they happen because of uh, human papilloma virus. So we have developed a vaccine against human papilloma virus. Now we have two types of vaccines uh, which are there for human papilloma virus. And one is a trivalent vaccine. Trivalent vaccine means that it covers three strains of human papilloma virus, that is 11, 18, and 16. And we have a bivalent vaccine. Bivalent means that covers only 18 and 16. The advantage of the trivalent is that the strain 18 is responsible for vaginal warts or cervical warts. So, which is also a kind of a predisposing factor or a risk factor for cervix. So, these vaccines, if you take, and the ideal time to take these vaccines is for all the ladies or the girls who are between the age of 13 to 26. Why 13 to 26? Because we presume that ladies are not sexually active during this stage. And that is the best results you get. And that is the time when you have not contacted human papilloma virus. Your body is free of human papilloma virus. And that is, and this is the time when you take a vaccine. So you develop good amount of antibodies against HPV, and this provides almost 80% protection against cervical cancer. So these two vaccines like Gardasil and Cervarix that we have are given, three shots are given at 0, 1, and 3 months interval, and the other is given at 0, 3, and 6 months interval. So that is how we do it and we give it. Now, if a lady is beyond the age of 26, is she not, eligible for a cervical cancer vaccine? Yes, she can get it, but you have to test for human papilloma virus first. So if you test negative, in spite of being sexually active, and you test negative for human papilloma virus, you can still take the vaccine, and this will protect you almost 80% protection. The other things that we do for screening and for prevention of cervical cancer is what we tell our patients is to get an yearly checkup done, as I told you earlier. Now, and you need to maintain a good personal hygiene for yourself. And in case if you have multiple sexual partners, make sure that they also maintain a good hygiene, personal hygiene, and preferably use a barrier contraceptive or something, or a barrier method which prevents transmission of infections through the sexual contact. Now, coming to some data, after all these things, that how far we have reached in cervical cancers. Now, cervical cancer as of today is not the number one cancer which is killing our Indian population. Other cancers like breast, lung, they have overtaken uh, the cervical cancer, and primarily because of improvement in hygiene status of our people and vaccination. Vaccination has drastically reduced the incidence of cervical cancer in our population. So that is why in urban areas, we do not see too much of preponderance of uh, cervical cancers. Now, last but not the least part of my presentation, I would definitely like to consider certain risk factors for cervical cancer and how you can avoid these risk factors. and save yourself from cervical cancer. Because, as I said, 20% of the cervical cancers are not related to human papillomavirus. So, first is that you need to have an vaccination against human papillomavirus. Number two, you need to have a good dietary requirement. Like there are some data which says that deficiency of certain vitamins like B12 and vitamin D3, which are responsible for, you understand your genes. So whenever our genes multiply, invariably they have a tendency to form some faulty genes. Now, vitamin D and B12, they help in a process what we call as MMR, that is mismatch repair. If a faulty gene is formed, so vitamin D along with B12, they help in reversing this faulty gene formation and it corrects the gene formation. So one thing, we need to have a good diet, we need to maintain good B12 and vitamin D3 levels. That is one of the preventive methods that we can take. The other is, as I said, regular exercise. Now, you would say, why exercise in cancer? Yes, because if you are regularly exercising, there is a continuous blood flow within your pelvis, and all the toxins that get deposited there, or the chances of the infection that is happening there, gets washed out. So hydrate yourself well, do plenty of exercise. Exercise builds up your general immunity, which also fights against cancer and keeps you fit. We also know that obesity, that is being overweight, is also one of the big risk factors for developing cancer. And cervical cancer also develops in people who are excessively overweight. So these are one of the parameters that we can take care in our life to prevent ourselves from cervical cancer. And with this, I would like to finish my talk here and address any questions what people have. Any questions, I would be really happy to take up. I do not see any questions, in my chat box. Oh, I just got one question. Want to understand how to detect it at early stage for the sake of the family members. Yes, I just mentioned the easiest way to detect cervical cancer is go to your oncologist. They will just do a colposcopy. They'll just examine, because in cervix everything is visible. So just a clinical examination can detect cervical cancer, which is one of the very simple ways to do it. And you can do a pap smear, which is the scraping that we take from the cervix and examine under the microscope. That you can do it once in a year. Oh, there's another question from Ms. Pratibha, that should women under the age of 30 years get cervical cancer vaccine? I said that if you are sexually active, you need to get the HPV tested, that is, you get a human papillomavirus test done. If you are, if the test is negative, you can still go ahead with the cervical cancer vaccine. And if you are sexually inactive till the age of 30, you are still eligible for cervical cancer vaccine. Deepa Lalwani, I am suffering from cervical cancer from last 10 months. Mostly my left side of the spine, hand, leg are under pain. Also, I am suffering mostly from left-sided headache. See, these are all signs of probably, kind of a uh, fairly advanced cervical cancer, or you due to treatment you can have these issues. So for all these things, I need the complete details of your treatment and what was the initial stage, what is the kind of treatment that you have received, and what chemotherapeutic drugs have you got, or what are the other comorbid conditions. Then I can give you a complete answer to this question. Mr. Anit Kumar, can you please suggest best algorithm for diagnosis of cervical cancer? I have mentioned multiple times in my talk, the best algorithm is a clinical examination, because you don't need rocket science to diagnose cervical cancer. Uh, Clinical examination followed by a pap smear or a biopsy is the best way to diagnose cervical cancer. Srihari PS MH1, I can all fibroids be cancerous? No, all fibroids are not cancers. They are just benign tumors which happen. Only part of it, some of the fibroids, they go into development of the uterine cancers. Revati says that, are there any side effects with HPV vaccine? As of now, whatever we have seen in our practice, no. But yes, the literature does mention some neurological complications with cervical vaccine, which happened in the initial phase. But as of now, we don't see any of them. And we don't even know what was the reason for those neurological issues, whether it was pertaining to the vaccine or something else. Any vaccine to be taken, how effective, and what does it prevent? And any age limit? Yes, I mentioned that vaccine gives you almost 80% protection from cervical cancer. And the best time to take the cervical cancer vaccine is between the age of 13 to 26. And this vaccine basically prevents you from getting the human papilloma virus. I am 34. Should I still take the vaccine? What's the efficacy? Yes, I told you that if you are 34, what you should do is get yourself checked for human papilloma virus. And if you are negative for papilloma virus, then you can still go ahead and take the vaccine. And it will still be efficacious for you. No more queries. So with this, I would like to log out here and thank you all for a very patient listening. And please try to spread this message to your family, friends, and colleagues so that they can get a good protection from cervical cancer. Thank you so much.